We possess the power to act, to lead, and to face adversity. Together, we stand to fight an invisible enemy. Together, we lead as one to win an invisible war. Together, we strive to preserve the voice of the future. The decisions made today determines the outcomes of tomorrow. It's time for you to decide.
Hello, good afternoon, ladies and gentlemen, and welcome to to JCI Manila's COVID-19 webinar series about the Delta and Lambda variants. And also today we'll be tackling how effective our booster shots will be against these variants. But before we start, may I call on our 2021 Executive Vice President, John Ross Francisco, for his opening remarks.
Magandang araw sa lahat. First of all, I hope we are all keeping safe and well. That in itself is already challenging. After over a year and a half into the pandemic, cases are still rising and even recently logged in the highest number of new cases at over 18,000. The best way to combat any situation is for one to start with educating oneself as to the overall landscape of things and knowing what are the tools needed to overcome it. As much as there have been countless articles for us to read up on, for today, we would want a more in-depth discussion on how things are and what is the outlook in the near future as well as long-term. So I want to personally thank our speakers for today, who will properly be introduced after, as well as to all who are here in attendance, as we can only win against the COVID-19 pandemic by doing it together. Maraming salamat sa lahat. Take care.
Again, everyone, welcome to JCI Manila's COVID-19 webinar series. Today, we will be tackling a very important and urgent issue. As we all know, the past 3 days, we've had all-time highs in our infections. And I believe personally that COVID-19 is getting close to the heart. And I want to personally thank our speakers for allowing us to be enlightened by their insights as they talk about the Delta and Lambda variants and the outlook, as well as the efficacy of our booster shots when they come and if they come. But first, before I introduce our first speaker, I just want to acknowledge some of our VIPs. Of course, I want to acknowledge the presence of our 2021 JCI Manila President, President Richard Tamayo. Welcome, Press. Thank you for gracing us with your presence. And also, everybody, thank you for tuning in our webinar series today. It's a very urgent, very urgent issues that we have to tackle. Okay, on to our first speaker. Dr. Tony Liatron is a Filipino physician, leader, and preventive health education and health reform advocate. Dr. Liatron graduated from UST Faculty of Medicine and Surgery in 1985 and was one of the PRC Medical Board top-notchers in June 1986. He finished his residency in internal medicine at Manila Doctors Hospital and his fellowship in cardiology at the UPPGH Medical Center from 1990 to 1992. He has extensive experience working in the corporate world as a medical director of Unilever Philippines from 1993 to 1995 and medical and regulatory affairs director of Pfizer Philippines from 1995 to 2010. Dr. Liatron has won several awards and recognitions as an outstanding physician leader and health advocate. He was also the past president of the prestigious Philippine College of Physicians, a 10,000 medical organization of internal medicine specialists in the country. He was also appointed by President Ninoy Aquino III as an independent director of the Philippine Health Insurance Corporation, representing the Monetary Board last January 19, 2016. He is currently serving his second term as the president of the Manila Doctors Hospital Medical Staff Association. And during this pandemic, he served as a special advisor to the National Task Force of COVID-19. Ladies and gentlemen, please welcome Dr. Tony Liatron. Dr. Tony, thank you for joining us.
Yeah, so let me. Yeah, okay.
Thank you so much again, Doc.
Thank you very much, Commissioner Andre, for that gracious introduction. Can you see my chart?
Yes, sir.
Okay, thank you very much. Officers and members of the JCI Manila, good afternoon. It's a pleasure to be the first speaker of your webinar series together with my good friend Edson Guido. And perhaps we will learn more from the projections on the COVID. But I'm delighted to be part again of JCI. Perhaps this is my fifth lecture on JCI of different, I would say, districts. Last time I had this opportunity to lecture at the Quezon City, and I, I'm always delighted with the opportunity to add value to your meeting. So today, okay, so for the second time, okay, I'd like to thank the JCI for this opportunity to add value, and I will share this particular uh, lecture series with Edson Guido. Next slide. So I think Edson will come in at around 6 o'clock. And I'd like to present the global and the Philippine data, the overview of the variants of concern, and of course the Delta and the Lambda, they're presenting manifestations. And let's discuss breakthrough infections, basically after the vaccination. And what are the current vaccine updates locally and of course globally. And then some tips on how to prevent and treat the COVID infection. On the next slide, I'd like to discuss again the Thomas Peo concept, in which you would like to, of course, discuss the lockdown, and this is basically the reason behind the lockdown. If you have increased number of cases in the acute surge, basically the strategy is to slow down the virus, and you can do this by hammering, um, and then there will be no people that will be going out, so walang lalabas, essential workers lang. But while you are in this particular stage, you have to do the other things like increasing the healthcare capacities, preparing the manpower, and of course all the protective gears. And once these mitigation measures are done, basically dapat mabilis lang. Then you can actually open the economy when the cases are actually at manageable level, and we call this the dance segment of this particular concept. Now, on the next slide, we'll show you that the global picture. We have 205 million cases at this point in time, with 4.3 million deaths, and still right now spreading because of the presence of variants. And this would actually change the landscape of the management uh, of the COVID cases. Medyo may echo ng konti. I'm sorry. Okay. Yan. Okay. On the next slide. So in this chart, you can see that it took about 10 weeks for cases to go up during the initial phase during the 2021. But with the arrival of the variants, the UK, the South Africa, and the Brazil, you see here an increase in the number of cases in about 6 weeks. And this is actually driven by the advent of the Delta variant, particularly in India. In the next slide, you will see the country of origin, which is actually the India. In this particular slide, you will see that around April, you have 400,000 cases. But because of their mitigation measures, of course, the lockdown, you have testing, tracing, and aggressive vaccination efforts, they're averaging right now almost 9 million cases. And then you see here only 30,000 cases at this point in time. So in about 3 months, performance because of their adherence to the playbook. You will see here okay na India at this point in time. So this is one success story that the origin of the Delta variant has right now flattened the curve. Of course, there should not be complacency because this may actually be repeated. As you can see, nagkaroon din ng mild spikes ang India during the time when we had the July, August, but this was managed, no? But this was actually repeated na nagkaroon sila ng political rallies, no, initiated by their Prime Minister Narendra Modi. In the next slide, now this is a situation in Southeast Asia. Of course, the epicenter is actually Indonesia, and then followed by Malaysia and Thailand, and of course the Philippines. So this is the basically situation. And in the next slide, I can show you that that Indonesia has been a success story as well, and they did the usual playbook of lockdown, testing, tracing, and then they changed their vaccines from Sinovac to Astra and then Moderna. But and you can see that from 50,000 cases, nagkaroon sila ng downward trajectory here. Right now, they're averaging around 18,000 cases. So just like the Philippines, no, nandun tayo din sa problemang to. But if Indonesia can do that, then perhaps we can also do it as well. So I just showed you two examples of countries na one with the origin or the country of origin of the Delta variant, and then Indonesia. No? So next slide. Right now, we're actually on the third surge. We had our first surge during the July and August when we had a hard lockdown. When we reopened the economy, we had 6,000 cases. And then this was the time when the medical community called for a timeout, no? And it was granted by the president, not ECQ but MECQ. But still, you have a downward trajectory, and we managed this until March, no? But we were not able to anticipate the arrival of the variants, no? Particularly UK, South Africa, and Brazil. And then when we started on March 1, the vaccination, nagkaroon tayo ng surge dito. And I think the peak was around 15,000. And then they imposed the ECQ and then the MECQ. Pero we should have actually waited for around mga 2,000 to manage it. But ang nangyari, we opened the economy again, coinciding with the arrival of the Delta variant. Kaya tayo nagka-surge ngayon. So in the next slide, this was yesterday, no? Gusto ko lang ipakita yung discrepancy in the reporting. And I usually rely on Edson Guido's report every 4 o'clock because more accurate siya. So this was yesterday na 18,000. This is the highest single tally of new COVID cases. And on the next slide, I'll show you. Now, this is the report today. And imagine yesterday, 18,000 tayo. Ngayon ang report ay 12,000. So we have to understand this may be actually late siguro na submission ng laboratory data. And this is important to note. Ano? And then you have to look at the number of deaths. So if you have an increased number of cases, let's say this would actually be 10 laboratories. So siguro mga 19,000 tayo ngayon. That's the real picture. You will have, of course, a full healthcare system. And definition ng full hospitals about 70%. And then you have an increase in the positivity rate, which the normal is less than 5%. And then you have a low number of testing, dapat mga 100,000 to. So if you have here an increase in the positivity rate, so 1 in every 4 patients, magpa-positive siya. So kung wala kang testing, you will not be able to understand na negative siya, pwede siya magpunta sa trabaho. Kung positive siya, dapat siya i-isolate or quarantine in designated area. Very important yun eh. Now, when you have increase in the positivity rate, you will have increase in the number of cases, and this will also cause problems, ma-overwhelm yung ating mga doctors. And that will be a problem. So, ganun natin ina-analyze yan in that sense. No? In the next slide, according to Edson Guido, of course, Edson will explain to us kung paano niya ginagawa yan on a daily basis. But again, 10 laboratories were not able to submit. So yesterday, 18,000. So granting that 10 or let's say 500. So kung makikita natin ang trend na 25% positivity rate, so it should be higher than yesterday. So mga 19,000 tayo. And this is the reason put forward by the Department of Health that the relatively low number of cases is due to lower laboratory output. And usually, nangyayari ito pagka Saturday, Sunday, Monday, and Tuesday. And also, they announced 303 deaths, and this is the fifth highest reported in a day. And the positivity rate, as I mentioned, is 24% for the fifth straight day. So you don't have to be an expert. You need to understand that there are certain things that we have to look for. And we are not in a good situation considering ang taas-taas ng positivity rate natin, ang taas ng deaths natin, and then ang taas din na natin ng cases natin. And when we have problems like this, hindi natin mamomonitor yan. But for me, I'm doing this for the last 17 months. Kaya medyo predictable kung ano magiging decision natin. So next slide. This one would tell us the story, no? This is a nicer slide do sa JHU kasi clear na clear here. When we had two index cases noon, and I was summoned by the National Task Force to be with the IATF and the NTF to give medical inputs, no? Ito ang tunay na hard lockdown. So makikita mo, ganito. Ang sa atin kasi is hindi na yan tunay na ECQ kasi a lot of people are moving around. Ano? So makikita mo, naka-third surge tayo. And ito yung difference when you actually manage mga 2,000 yung cases. So tayo, we reopen the economy ng mga 5,000 ang cases. Yan ang mangyayari if we open up. So based on that, the hammer and dance concept of Thomas Payo, you have to really manage the cases around 2,000 so that you can actually reopen the economy. And nangyari sa atin, prematurely, we opened the economy and then nagkaroon tayo ng surge. Next slide. So this is from Edson Guido. So we have 1.8 cases now total. Ang active natin is 127. That's huge. And we have 32,000 deaths. And again, as I mentioned, puno yung ICU natin. So ang problem natin when you have a full hospital and you have increased number of cases, there will be a lot of mortality, perhaps outside of the hospital, which may not be actually be recorded. Yun ang magiging problema natin. Next slide. Now, so this cartoon will basically explain our problem. When we actually have surges, ang ginagawa natin, stricter lockdown. Pero ang situation natin, because we want, of course, to manage the business, hindi tayo nagkakaroon ng strict lockdown. We see a lot of people walking around and then may decrease tayo ng testing. Ngayon, ang mangyari with the slight dip or decrease in the number of cases, the IATF, through, of course, the prodding of the economic sector, will reopen the economy. Pag reopen natin the economy, increase the social mobility, magkakaroon tayo ng surge in cases. Ang strategy should be actually when you have a lockdown and you have to manage the cases to around mga 2,000 or 1,000 and then gradually phase down opening of the economy, hindi abrupt or prematurely. And that's the reason na nagkaroon tayo ng problema because it's a perfect storm system. Nagkaroon tayo ng opening of the economy at the time na may Delta variant and then wala tayong testing, kulang ang contact tracings natin. So this would explain the entire vicious cycle of a CISO lockdown as well as ping-pong decision-making. So meron, ang tawag dyan dissonance or discordance between the diagnosis and the implementation. So imagine, let's say you have an increase in the number of cases last week ang tendency mo dapat mag-ECQ, but the decision was actually an MECQ. So yun ang tinatawag nating discordance between the diagnosis and the policy and the implementation. The next slide. Now, meron tayong plano, no? And we crafted this together with the National Task Force and the IATF. Pero ang main problem natin is actually on the testing. So you have to prevent, detect, isolate, treat, and reintegrate. But our biggest problem is actually on the testings and then the contact tracings. But these two important measures are actually yung weakest link pa naman natin. In other countries, ang strategy lang ay testing and tracing and of course, vaccination. Next slide. Our problem is the testing because nagkaroon tayo ng price ceiling but still very prohibitive ang price at around 4,000. If you're a minimum wage earner, hindi ka talaga makakapagpa-testing. And in other countries, libre ang testing like the US or Israel and other countries. So to me, the most important measure, the most important pillar to control the COVID-19 is actually testing. And then, of course, you need to do tracing. And after that, you can actually do the isolation quarantine. But to me, you need a diagnostic tool to find out kung sino negative and positive. So in other areas, like in the US, makikita nyo sa pictures nila, libre ang kanilang testing. And then, ang kanilang parameters lang, increasing your positivity rate, which is actually, ang metric niyan is actually the testing and then the vaccination rate. Next slide. So we are now in a high-risk situation. And as you can see, every day, we're anxious about the number of cases. And this is secondary to, next slide, to the presence of Delta variant. No? Ang limitation natin is that hindi natin ma-diagnose during the time because of our limited genome sequencing. And we just assume that because it is every LGU nagre-report na ng Delta variant, we assume that the present surge is driven by the Delta variant. So ganun lang ang situation natin. In the next slide, I'd like to explain yung mga strain. The original Wuhan strain was first discovered on December 8 of 2019. And then China declared the presence of the coronavirus epidemic sometime in January, I think January 25. And then the WHO declared a global public emergency. And then the second variant out of this Wuhan strain is actually the D614G. And this was responsible for the July-August surge of last year. And then you have the UK, the B117, and then the South Africa, and then the Brazil, and then the Philippines, and then you have the India sometime in April, and then the Lambda, which was declared present in the Philippines, I think last week. Next slide. So we had the first recorded case of Lambda on August 15. I'll try to explain and describe this particular variant vis-a-vis the Delta variant. Next slide. Now, the WHO used a new naming system because using the country will actually stigmatize that particular country. So from the numbers and the country, they use the Greek alphabet. And there are only 4 variants of concern. When you say variant of concern, it's actually the increased level of transmissibility to create a widespread epidemic. And these are actually the UK or the Alpha, the South Africa or the Beta, Brazil, Gamma, and of course India. And these are just variants of interest, but we had to monitor the transmission of these particular variants in other countries. Next slide. The problem with this particular Delta variant, it is becoming apparent that it is present less than 18. We know for a fact that the vaccination would start from 18 and above. No? So ang naapektuhan based on the Ministry of Israel and this is also becoming apparent also in the Philippines, that a sizable proportion of the population, in fact, in Israel, they have identified 40% or 50%, including those 0 to 9, to be afflicted with the Delta variant. So the trending is actually hindi lang sa matanda adult, but also in the pediatric age group. Next slide. So we have COVID kids right now a growing concern, not only at the Philippine General Hospital, but other private hospitals. And when you do the telemedicine, you will see a clustering of COVID cases. Not only the parents are actually afflicted with COVID, but also yung mga kids, no, because of the lack of vaccination program pa in our country. Though it's approved, no, in the US, approved na yung 12 to 15. And I think they would start particularly with the full approval of Pfizer yesterday. In the Philippines, we have approval for 12 to 15 for children or for kids at 12 to 15. But because of the lack of stocks, particularly with the Pfizer vaccine, hindi pa tayo nakakapag-umpisa. And this is actually important so that we can actually start the face-to-face classes sa DepEd and of course sa CHED. Next slide. Now, what's the difference between the original Wuhan strain and the Delta variant? No? Well, the Delta variant will actually create problems for us because it can actually be cause twice as many infection because of the reproduction number. In the next slide, you will see that the reproduction number is important. The higher the reproduction number, the more contagious. So the original Wuhan strain has a reproduction number of 2 to 3. So it can actually infect, one person can actually infect 2 persons. And then a Delta variant can actually infect 5 to 8 persons. And this is the problem because of the rapid transmissibility. You will have more problems, particularly in densely populated countries. So nakita nyo, the most populated one of the most populated countries, no, if not, no, India, more than 1 billion ang population niya. And then Indonesia, I think Indonesia is the 4th or the 3rd most populated country in the world. Kaya kita nyo, exponential yung increase. So just like Manila or the National Capital Region, this has become a problem as well. In the next slide, these are the quick facts about the Delta variant. It's 60 to 100% more transmissible. The Delta variant has, in fact, has 1,000 times in terms of the viral load. No, so highly infectious, and it would actually be not only in 15 minutes interaction, but actually in seconds based on the Australian experience, no? And it can actually spread in close, poorly ventilated areas. And it's more severe in its presentation among unvaccinated individuals. And that's the reason behind our push for full vaccination of the population. Next slide. So what is the common presenting manifestation of a Delta variant? Ito importante because if you will start the medication late in the course, the problem is actually deterioration, magkaroon tayo ng difficulty breathing, respiratory failure. So you have to start the medications right away. And then once nalalaman nyo yan, in the absence of the testing, that will be important. It's life-saving for the patient na ma-start natin yan. Particularly at this point na puno ang mga hospitals natin. Next slide, I'll show you that this would be the typical presentation of a Chinese Wuhan strain. And basically, the patient would have fever, cough, shortness of breath, muscle, body aches, headache, sore throat. The most important here would be the loss of taste and smell. No, napaka-common ito as a symptom of of a coronavirus. No other illness, no, that would give this except for the coronavirus. In the next slide, based on the study in UK, this would be the top 5 symptoms of COVID-19. Napaka-importante nito. And makikita nyo rito, wala dito yung loss of taste and smell. But this is an explosive presentation of headache, sore throat, and runny nose, fever, and persistent cough. Kung nakikita natin ang cases na original Wuhan strain, in about 5 or 7 days, you can actually have this manifestation in about 3 days. And once you have these particular symptoms, you have to consult through teleconsult or telemedicine kaagad, no? Because you need to start the medications right away so that it will not deteriorate, no? Ang nakikita right now natin sa hospital, kaya toxic ang presentation is because the late arrival in the emergency room, lalo na kung puno yung hospital. Next slide. Now, how about the Lambda? The Lambda variant was first cited in Latin America, and particularly in Peru. No? So I have a few slides on this, but this is not as important as the Delta variant, but we need to monitor this particular variant because this will create problem for us if we cannot identify this through genomic surveillance. Next slide. So the Delta variant is actually found in Latin America, particularly Peru, no, and Chile, and this is actually a concern for them because of their transmissibility, and of course it will also affect yung, aside from being infectious, is also it would render the vaccines ineffective, and this is the important attributes of the variants Delta and Lambda. Number 1, increased level of transmissibility. Number 2, it would render the vaccines ineffective, particularly in countries na gumamit ng Chinese vaccine. So I will explain later on kung ano nangyari in those countries. Next slide. So the Lambda has been identified in other countries, no, but not as much as in Latin America. And this has been classified as a variant of interest by the World Health Organization in June. So it's not a variant of concern, but a variant of interest. So binabantayan natin siya. Next slide. Now, so we're tracking this. Now, when do you say na ang variant of interest naging variant of concern? Number 1, when you have increased transmissibility of the virus, okay, so that will show a detrimental change in the epidemiology. Number 2, increase in the virulence, and then changing the disease presentation or symptoms, and it would also show the decrease in the effectiveness of the testing, treatment, and preventive measures. So that is the classification for a variant of concern. So it's a variant of interest pa lang based on the World Health Organization's classification. Next slide. Is the Lambda variant more transmissible? Well, according to studies, it may actually have an increased transmissibility or increased resistance than the Delta variant, but this is subject, of course, to research. What I know right now, the Delta variant is highly transmissible than the Lambda variant. But there are studies that the Lambda can actually be more transmissible than the Delta variant. It is present in around 23 countries as opposed to the Delta variant, which is present in 130 countries. Next slide. Now, based on the records of the hospital admissions, 90% of the COVID cases are present actually in those unvaccinated individuals. So yan ang problema natin. So we have a very low vaccination rate at around 12%. Next slide. Now this one is the Swiss cheese respiratory model, and this one is a nice analogy because each particular layer will actually be important, and each intervention has imperfection, no? Face mask, and of course your face shield, and of course social distancing and all. But we have, of course, personal responsibility and shared responsibilities with the government. But I think we cannot be on these particular measures for a long time. And vaccines would be the most important thing to end the pandemic. Because if we achieve herd immunity, then we will be able to reopen the economy. Next slide. Now, the first vaccinee was a 91-year-old grandmother. And this was given by a Filipino nurse. And this particular vaccine, by the name of May Parsons. And this particular vaccine would help us to make antibodies that would destroy the SARS-CoV-2. Next slide. Now, we say that the vaccines will be important in protecting us from severe disease and protecting us from hospitalization. So everyone should be vaccinated regardless of the brand, no? Because we might be actually be dealing with the dominant Wuhan strain. And then later on, we will decide on the booster dose. Now, of course, this would vary in efficacy. BioNTech and Moderna are actually mRNA vaccines. And then AstraZeneca, Gamaleya, and Johnson & Johnson's would belong to the same platform, adenovirus vector. And then Sinovac will be inactivated. So they would say that we should not choose the vaccine because the best vaccine is the one available in your arm. So that was the mantra during the March 1 launch sa PGH. But because of the Delta variant, we need to understand the complexities of the choice of the vaccine. In the next slide, we will see, based on the vaccine expert panel, that the efficacy rate will be important and also the effect against the variant, the Delta variant. Now, there are actually 5 vaccines that will be effective for the Delta variant. And this will be Pfizer. It will be effective for the Delta variant. AstraZeneca. This will be effective also. There are no peer review journal or publications for Sinovac or Sputnik. Next slide. Moderna will also be effective against the Delta variant as also, and the Johnson & Johnson. And the Covaxin from India. And they have reports on its effectiveness for this particular variant. So in summary, based on the 2 slides presented by the vaccine expert panel, and this was presented by Dr. Rodian Solante, a colleague of mine, the choice in the choice right now would be Pfizer, Moderna, Astra, Johnson & Johnson, and perhaps the Covaxin. And since you have some problems in other countries in terms of the supply, then perhaps we should consider procuring the Covaxin because of the success story in India. So that's my take on this particular slide. In the next slide, you have the inventory. Almost 40 to 50% of our inventory is actually on Sinovac, with Astra, Pfizer, mainly coming from the COVAX facilities, and then you have Moderna, you have Janssen, Sputnik. So we have 48 million doses, and basically we need to revisit right now are the particular vaccines that we will order that will actually be effective against the Delta variant and then the Lambda variant. Okay, next slide. So vaccines are very important. Next slide. Because these are safe and infectious vaccines. We need to be vaccinated to protect our families, our co-workers, and especially the elderly and those with comorbid conditions. With vaccination, we will be able to achieve herd immunity. And with herd immunity, we'll be able to reopen the economy and bring back our lives to normalcy. And the next slide will show you the herd immunity. This one would show us that as we actually progress in terms of vaccinating a majority of our population, like 70%, this will have a halo effect on those unvaccinated individuals. So right now we have around 12%. So this is 25% of the population. So we need to rapidly increase our vaccination rate. This is what we call the people's protection strategy of the government, that we, if we reach, let's say, 50% of the NCR bubble, we might be able to achieve our target of people protection by the end of December. But with the Delta variant, in the studies in other countries, you need about 85 to 90% of the population in order to prevent the viral transmission. Okay, next slide. So according to Rochelle Walensky, the CDC director, this would be a pandemic of the unvaccinated. There are around 93 million of the Americans are actually unvaccinated at present. Next slide. And the problem is the breakthrough infection, defined as infection occurring after 2 weeks after the vaccination. And full immunization is defined as 2 weeks after the last dose. Let's say for 2 doses, the second dose, and for, let's say, Johnson and Johnson, 2 weeks after the vaccination. So we have to differentiate the adverse events will be actually be present within 48 hours, and then the signs and symptoms related to a COVID infection, and that will be present about 2 weeks after the vaccination process. Next slide. So let's say if you suffer from COVID-19 breakthrough infection, you will likely to have mild illness and not be hospitalized, but you can still contract the virus and pass it to another. That's why they updated their face mask guidance in the US. Next slide. So we need to be vaccinated because the vaccines really would work, and they continue to work well for Delta. Of course, that's in the United States when we have high quality vaccines like Pfizer, Moderna, and Johnson and Johnson. They can prevent that, but they cannot do anymore to prevent a transmission. So ibig sabihin yan, even if you're vaccinated, right, you can have breakthrough infections, but the infection will be less severe, less people to be hospitalized and suffer from deaths, no? But you can still contract the virus and then infect those individuals in the household, no? Particularly yung mga elderly and of course those with comorbid condition. And of course, the pediatric age group. So napaka-importante talaga mabakunahan yung buong pamilya natin so that magkaroon din tayo ng family herd immunity. Next slide. Now, about the booster. So the President Joe Biden announced, I think last week, that most Americans will need a booster shot, no? And of course, Israel started with the booster, 60 years old and above, for those senior citizens and those with comorbid conditions. Next slide. The US will begin offering vaccine booster in September. And this is great news for the US, considering Pfizer achieved a milestone. Nagkaroon na sana ng full approval last night. So this would mean the private sector can actually procure the vaccine, and this will facilitate the vaccination in the US, including the children. Napaka-importante nun. For us, we need to just adopt this particular regulatory approval so that the private sector can procure the vaccines just like in the US, particularly for American vaccines na approval in our country, so that the private sector can order, let's say, Pfizer, Moderna, and Johnson & Johnson. But at the moment, ang meron tayong full approval is actually Pfizer. But I'm sure Moderna and Johnson & Johnson will follow. Next slide. But fortunately, I think it is included in the 2022 national budget, no? 45.5 billion for the booster shot. And that's good. So I think by January, we will be able to procure more vaccines for booster shots. For at the moment, we need to think about the future. So what are the vaccines that will be available for the Delta variant na may full approval na? And I think that's Pfizer. But we need to think ahead on ordering vaccines that will actually be approved also for booster shots. Let's say Moderna will be next in line, and then perhaps Johnson and Johnson, and then AstraZeneca. But at least we have the budget for 2022. Next slide. So why do we have to be vaccinated? And I got this particular Twitter slide from Dr. Melvin Sanicas, a well-known epidemiologist, a Filipino vaccinologist in UK and Switzerland. The first reason is we want to be vaccinated because we want to protect ourselves. We want to get the immunity the safe way, not from COVID, to prevent the long COVID, yung COVID na more or less more than 100 days, you still have the manifestation of a COVID, reduce the number of cases of hospitalization and deaths. And of course, the last one is actually to help end the pandemic. Napaka-importante na mabakunahan tayong lahat. Next slide. Now, ang problema natin in the Philippines, we don't have a dashboard or a scorecard. We cannot manage what we don't measure. And this is from Peter Drucker, management guru. Next slide. And based on the WHO criteria, we need to consider the following when we lift the restrictions. Is the viral transmission controlled? Are the health system in place? Are we protecting the healthcare workers in the hospitals? Are the preventive measures in place in the workplace, in the school? And have we managed the importation risk like returning overseas Filipinos? This is very important. And lastly, and the reason and the spirit of this particular webinar lecture is to engage more people to be educated and empower them as well. Next slide. But we need ruthless consistency. This is from a book that I'm reading right now. And we need to have more leaders. Leaders with focus, leaders that would create the environment of public safety. But we need to have a team that can actually address the problem. So yan ang problem natin sa Pilipinas. We don't have that kind of consistency. But we can shrink the problem. If the private sector can do this, if the family can do this, then perhaps they can create a ripple effect in the society. Next slide. Now, we were hoping that during the SONA that the president would have a checklist like this, and I had the great opportunity to be interviewed together with some key opinion leaders. That perhaps the Congress and the Senate would have this kind of checklist that we would emphasize ventilation, we would have pre-testing for essential workers, and of course we need to have a contact tracing infrastructure and create a network or facilities for barangay and tertiary hospitals. We need to improve on the payment for our healthcare workers. We need to have, timely and complete data management. That is a problem again. We have to have clear and consistent messaging, not trying to stonewall or, try to window dress certain information. Yan ang problema sometimes. We need to improve safety in the mass transportation. And number 9, we keep the vaccination simple and transparent and provide economic stimulus in case of lockdown or ayuda. This is actually a wonderful checklist for the long haul. Going down to my last 2 slides, I think. But accountability is key, and we see that right now when we have problems with the 67 billion COA funding being investigated by the Congress, I think it is important that we be accountable. We should demand accountability as well. Because according to Thomas Paine, a body of men holding themselves accountable to nobody ought not to be trusted by anybody. This is very important, particularly in this particular crisis that we have. And my last slide would be on my favorite movie, that's the Harry Potter series. We can make the choice to live as socially responsible citizens, or we can descend into anarchy. We can make a choice to follow the rules or break them, or we can make a choice to be right or wrong. So we are given abilities and talents. But talents and abilities are nothing if we will have the wrong choices. So according to Albus Dumbledore, it is not our abilities that would show what we truly are, and basically it is our choices. So with that, I'd like to thank everyone for listening, and I'm actually open for some questions if there are. And I think we're ready for Edson Guido as well. Maraming salamat po for your attention, and I apologize for the technical glitch.
Thank you, Doc. No problem about the technical difficulties. Thank you for that very informative presentation. I believe everyone's anxious about our current COVID-19 situation in the country, but being better equipped with the right information makes us better equipped to defend against these other variants of COVID-19. Thank you, Doc. Speaking of being better equipped with information, yes, we do have a few questions from the audience for you. But before I go on to asking you those questions, I just wanted to acknowledge the presence of our Vice President, Richard Dodds Lim, Past Director Jaime Barlizo, and Past Director Paulo Balinas. Thank you for joining us today. And also President Angel Angliongto from JCI Davao Dabadaba. And all our sisters from JCI Sugs and of course from Dabadaba as well. Now on to our interview portion, Doc. I have a few questions for you. First question from Com Harold Glenn Labugen. Good afternoon, Doc. Can you enlighten us about the latest studies about the effectivity of mixing vaccines? Are these safe?
Okay. Though we don't have any guidance, but that's an important question because yung mix and match, there are three reasons for nagmi-mix and match ka. Una muna lumabas yan with the perceived, of course, the adverse events related to vaccines, let's say AstraZeneca nung nagkaroon ng rare blood clots, if you remember, and then Johnson and Johnson. Now, for a time, na suspend yung Astra, I think 2 weeks, no, even in Europe. And then there are countries that nag-weigh sila na, let's say Denmark, Netherlands, na they actually pulled out yung AstraZeneca in their countries while other countries nag-okay. So doon nagkaroon ng Spanish study na using Astra and then Pfizer na effective siya. And then Germany, I think Chancellor Angela Merkel, initially she used yung Astra and then a second dose niya ay Moderna. In Canada, Justin Trudeau, I think the regulatory approval from Astra naging Pfizer siya. So yun ang first reason. The second reason is that when you have a very tight global supply, for example, Korea, nagkulang sila, Astra, not because of adverse event, because ang position niya, like our country, is that the benefits would outweigh the risk. So umorder sila from the US ng Moderna and Pfizer. So that's the second reason natin. And then number 3, when the primary vaccine na ginamit natin would not be effective against certain variants of concern. Kaya in Indonesia, nakita nyo the studies, nag-shift sila from Sinovac to Astra and then to Moderna. Ganon din ng Thailand, ganon din ng Malaysia, then Bahrain, and then UAE. And then in Chile, they started first with Sinovac and then nag-Astra sila. So, yun ang decision yun, ang regulatory. Sa atin naman, we have not come to a point na ganon. But, you know, if you understand, of course, regulatory, and for full disclosure, I used to work with Pfizer, nakita na ng US na some vaccines would be ineffective for the variant. And that's the trigger or the impetus kung bakit sila nag-apply ng booster in the US. Because even with the high-quality vaccine na Pfizer, bumaba ang effectivity ng Pfizer by 10%. Nakita nila sa Israel yan. Nung nagkaroon ng rise sa children and then sa vaccinated area. And that's Israel. Israel is the first country not to reach 60% vaccination. And Israel yon, which is a model country. And US, these are not countries na sasabihin natin kulang sa bakuna. But they recognize that meron silang vision na bumababa ng 10%. So, nagpapabooster tayo. Now, in our country, we have to plan for the mix and match and also for the booster. And we have right now, alam nyo naman ang cases natin, perhaps 18 to 20,000 will reach it this week. At nagkaroon tayo ng Delta variant, we should be ready to shift gear kung hindi effective yung ating primary vaccines. Right? So right now, kailangan ubusin natin ang inventaryo natin. But we should be ready with the supply just in case we'll suffer for the same predicament like India before, di ba? So ganun dapat ang ating concept. Particularly ngayon, September, we have only 4 months before the timeline ng ating tinatawag na people's protection, about 50%. But ang problema natin is the supply. So we need to anticipate the supply just in case we will have a surge of the Delta variant in the next 2 months. Okay. I hope, sorry, that's a long answer to a very important question, and I hope I was able to address your question.
Yes. Thank you, Doc. Second question. So Taiwan has developed their own local vaccine, and their president actually got her vaccination yesterday. You think the Philippines should and can do this to prevent reliance on foreign nations and countries?
Okay, very good question again. To start with, kasi ang healthcare system natin, di tayo nakapag-invest for 4 decades. Not only in this administration, medyo napabayaan natin ng healthcare system natin. I'll tell you, there are 3 components of our healthcare system. The first is actually human resources. In the 1960s, like my uncle, punta sa States, my uncle who passed away last month, no? Nagkaroon ng exodus ng doctors because of the Vietnam War. In fact, 70% ng class ng UST and even UP pumunta. And nag-continue yung trend na yun. Ano? In fact, yung mga doctors, nag-nurses pa. So we're the #1 exporter of nurses. And second in the world next to India sa doctors because of the higher pay. So ngayon lang natin na-realize this during this crisis again, hindi nabayaran na naman ng ating mga doktor. So ang first natin problem is human resources. Number 2 is funding. May problem tayo sa PhilHealth, di ba? Magdi-disengage na naman ang mga doktor sa PhilHealth. Samantalang we advocated for Syntax to raise the revenues for PhilHealth and the Department of Health. Ang Syntax is actually tataasan mo yung presyo ng sigarilyo at alak, tapos yung tax na makukuha mo, ibibigay mo sa PhilHealth at saka DOH. In 2012, kasama ako sa mga advocate na yan. And I was a 1 peso consultant of the Department of Health. From a 50 billion budget in 2012, ang budget natin ngayon ay 220 billion. So, na-quadruple natin ang budget. And yet, nakita naman yung investigation sa Senate and the Congress, nawala yung ibang pondo natin. Hindi natin naayos ang funding. So, dapat ang out-of-pocket expenses natin, dapat mababa na from 57%. Ang first peso kasi natin is actually PhilHealth. And then kung senior citizen ang babawasan. Sana the universal healthcare, yan ang trust niyan, bumaba to around 20% yung out-of-pocket expenses natin. Mapatulad tayo let's say sa Canada or sa US. Ang third natin problema is infrastructure hospital. Bigyan ko kayo ng example and this is a sad reality. No? Look at PGH and ang PGH, the best and the brightest doctors dun gagraduate, no? Scholar ng bayan. Pero nito lang napapa-improve natin ng facilities and that's 1 kilometer from the palace and the Department of Health. So do we expect the countryside to be better when the premier government institution yung facilities kulang lalo na sa ating mga scholar ng bayan as mahihirap? Then look around, even San Lazaro or Jose Reyes, near the DOH, no? So parang may elephant in the room syndrome. Hindi natin na-improve ang infrastructure din natin. And perhaps the next administration should invest more on our healthcare system. Okay, human resources, funding, infrastructure, and huli, tama yung sinabing question. Dapat mag-invest tayo on medicines. Pero kailangan natin ng R&D, Research and Development. Dapat yung mga scientists natin, papadala natin, let's say, sa US, mag-aral sa CDC or National Institute of Health, tapos may return service agreement. Pag nagkaroon tayo ng scientists, we build an infrastructure together with the genomic surveillance at saka vaccines, then we will be able to be an R&D company. Yan, ang R&D country. So, that's the future, no? Ang Taiwan kasi advanced na yan eh. That's one country na libre ang healthcare dyan. Kaya advanced ang Taiwan. And it's one of the countries na maganda ang management ng COVID. So it starts first with a stable healthcare system before we can do that. But that's a nice question. But it emanated actually from ignoring ang healthcare system natin for a long time. So we need somebody with a vision for healthcare system kasi napaka-importante ang health. Because health is wealth and nation's health is nation's wealth.
Thank you for your answer, Doc Tony. A few more questions from Stanley James Strong. How can the medical sector, government, and other stakeholders come up with the right pandemic response if the data shared by the health department is either inaccurate or mismanaged?
Yan, the very good question yan. During the time na when we were advocates for the syntax, nag-form kami ng coalition kasi I was given a free hand by Secretary Ona to manage yun eh. Kasi siyempre dami. Para bang merong advisor ng Secretary of Health. Parang kunyari ikaw si Dr. Anthony Fauci na nag-a-advise sa President. Kailangan may ganun. Kasi siyempre daming ginagawa ng Secretary of Health eh. Sabi ko, sir, alam niyo yung pinakamaganda niyan? We need a stakeholders coalition. Ano ibig sabihin yun, Tony? Yung public sector, yung technical advisors nila, meron ding private sector counterpart. And then the best and the brightest, pag mimix mo yan, merong economists, may epidemiologists, may data analytics, kunyari ni Edson, meron ka ring clinicians, may public health advocates, may communicators ka. Yung grupo na yon at yung grupo nun, mag-merge silang ganun. And then, opinion yan, magmamatter sa IATF discussion. Kasi, wala nang interest, pare-pareho yan eh. Yan ang magiging success story. Kaya, kita mo sa States, upon the entry of Joe Biden, ang una niyang ginawa is to assemble a 12-man team na medical advisors. Yun ang maganda. Coming from the private sector and the public sector. Nakita niyo yun? Kaya kita niyo ang bilis ng sa US eh. Ngayon, sana makuha natin. Pero kita mo dito sa atin, government side lang. Tapos yung private sector, meron nga nag-volunteer yung Octa Research Group na criticize pa, na imbestigahan pa sa Congress. Dito sa ating bansa, hindi open ang government sa opinion ng private sector. Di ba? So, nakita natin yan. Pero we have one country eh. So, ang maganda sana sa next administration, magkaroon ng ganyang coalition. Tapos, ang opinion niyan, unified. Anyway, magbobotohan naman sila kung ano yung proper way eh, di ba? So, hindi na yan boses ng private sector, hindi rin boses ng public, but isang unified medical team that will actually advise the government. So, walang taguan yun kasi yung data analytic expert ng gobyerno, at kunyari si Edson Guido na appoint dyan, mag-merge yun together with the Octa Research Group. Ang nangyari kasi, nagkaroon ng divergent opinion, nagkaroon pa ng competition instead of helping the country. I hope it's useful in terms of suggestion.
Thank you, Doc Tony. I actually wholeheartedly agree that the only way we can combat this virus is by doing it together. Last question, Doc Tony, before we let you go. From Samantha C. Assuming the rate of those vaccinated continues or increases, when do you think will the country be able to achieve herd immunity?
Okay. Ang crystal ball ko baka, sorry siguro 2 years tayo. 2 years tayo. Kasi 12% pa lang tayo, March tayo nag-umpisa. But tingnan mo ang India, ang bilis, in 4 months. Kita niyo yung slide, ang bilis eh. because of their passion and sense of urgency. In 4 months, nagawa nila eh. Tayo March na, March 3, August. 7 months na, 12% pa rin tayo. So again, kung meron sanang private sector that will help the National Task Force in the vaccine procurement, ang dami natin magaling na logistics, distribution, and in the pharmaceutical world that can actually help the government. So again, tama yung sinasabi natin, a public-private partnership program is important. Diba?
Ganda.
Okay.
Yes. Ganda. Thank you for your answers, Doc Tony. So informative. Your presentation was full of information that can help us on so many levels. Before you go, may I just introduce our next speaker and your good friend, Mr. Edson C. Guido, the head of the Data Analytics team of ABS-CBN News, the Philippines' leading media organization. He launched the team when he joined in 2017, dedicated to analyzing broader macroeconomic trends and crunching large data sets. Prior to ABS-CBN, Edson worked at the World Bank, where he processed and analyzed datasets published in official reports. He was recently presented the Datu Kamlong Banwe Youth Service Award by the National Youth Commission and JCI Davao Gulf. He is a PhD candidate at the University of the Philippines School of Economics, where he also finished his undergraduate and master's degrees and graduated with the program's highest honor. And from what I hear, he's a very big fan of Tim Grover and his book Relentless, just like myself. Please welcome Mr. Edson C. Guido.
Commissioner Andre,
Yes,
let me say a few words regarding si Edson. And this is an
Sure.
opportunity.
Go ahead, Doc.
Okay. I'd like to thank sincerely si Edson. No? My data are 80% Edson. And I'd like to congratulate and commend this young gentleman. No? Nag-uusap kami every day nito. He's a young hero of this pandemic. Without him, siguro, I will not be able to speak and merge yung aking clinical and public health experience without the data coming from Edson. If there's one hero in this pandemic, it's actually Edson. And thank you, Edson, for the opportunity to work with you. Belated happy birthday. And also, I also read Tim Grover, Relentless. Pare-pareho tayong basketball aficionado. Again, Edson, hindi pa kita nami-meet personally, but I admire you from a distance. And almost every other day, nag-uusap kami ni Edson. So take it away, Edson, and you're the hero of this particular pandemic. Maraming salamat.
Thank you for the kind words, Doc Tony. Actually, yun nga this event, itong event nyo ngayon sa JCI Manila, this is actually the first time na nag-meet kami ni Doc Tony virtually. Wow. And again, thank you for the kind words, Doc Tony, and I feel exactly the same way sa inyo. Grabe din yung ginagawa niyo, Doc Tony, for the country. And this pandemic, we really have to help each other. It's not really di kakayanin ng iisa or iilang tao lang eh. We really have to help each other because this is something na talagang unprecedented eh. So yung level of effort din natin has to be something na kailangan sabayan yung nakikita din natin na threat nitong pandemic, no. So again, I'm very honored for dun sa kind words ni Doc Tony, and again to JCI Manila, of course, thank you for having me.
Thank you so much. I'm actually very honored as well, sharing the screen with two of our country's biggest heroes during this pandemic. Doc Tony, hopefully before you go, may we just ask if we can give you a certificate of appreciation before we start with Sir Edson's presentation. There we go.
Thank you very much.
Thank you so much for your presentation, Doc Tony. We really learned a lot. Thank you. Okay.
Bye, Edson. Bye, Edson.
Bye, Doc.
Bye, Doc Tony. Thank you, Sir Edson, for joining us and for patiently waiting. Medyo na-late kami, but Again, we're honored to have you here, and please take it away.
Thank you, Andre, for the introduction, and good evening, everyone. Again, I'm Edson Guido, and thank you, JCI Manila, for inviting me. And I don't know if it's coincidence, no, but just last week I was given that award nga by JCI Davao, and before this, I have never attended any JCI event actually in my life, but now it's my second time in a matter of days, no. So if we look at the trend, and if this continues, I'll be attending, what, 5 more? No, I'm just kidding.
Hopefully, dumami pa po. Hopefully, dumami pa.
And so do we have the slides ready?
Tech team?
So just to give a brief background about myself, I head the analytics team of ABS-CBN News, and currently one of my primary roles is to crunch the COVID-19 numbers, and I've been doing this daily since March 2020. And actually, that includes weekends and holidays where I also check our TV Patrol stories. So this has really become a part of my daily routine now under the new normal. And I must say, it's not really an ideal setup, but of course, given this opportunity, anything that I can do to help our country, I'm really happy to do it. And I also present my COVID-19 analysis every day in an easy to understand format on my social media account, so you can check that out as well. And personally, it just became my commitment to help inform people during this pandemic. And when you're doing COVID analysis, you really have to take a deep dive into the granular data every day. It's not just looking at the top line numbers that DOH reports at 4 p.m., but you really have to dig deeper into the actual raw data set. And right now, it has 1.8 million rows of cases, as well as other data sets like testing, critical care capacity. And then you process all this data every day because, you know, the thing with COVID, unlike other data sets that we see, is that the trend here, it really changes. Really, every day, the whole thing can change. The trend can go from something that's looking good to something that looks really bad. That's how fast it can change, no? And you also have to look at all these things across different regions, provinces, and you have to monitor the trend through time. So it's really challenging, but it's been a year and a half, and I really hope that things will get better for all of us soon. As for my presentation this evening, basically we'll make sense of all these numbers, give the story behind the data, and then I'll be presenting the outlook. So let me show you first the daily confirmed cases as reported by DOH every day, because this is basically where everything starts, no? So the red bar here, this correspond to the new cases that are reported daily by DOH. And the white line, as you can see, that's the 7-day average to smooth out the daily variations. And as you can see from this chart, the peak of infections last year happened in August also, no? And DOH during that time was reporting an average of more than 4,000 cases in a day. And then we saw a significant improvement in the months after, up to the early part of 2021, as you can see from the chart. And cases during the early part of the year was actually were averaging less than 2,000 daily. And then in March, that's when cases rose exponentially, as you can see. And during that time, it peaked at an average of more than 10,000 daily. That's the average. And in fact, we even hit more than 15,000 for a day. That's on April 2. But because of the ECQ, followed by 1 month of MECQ in NCR+, we were able to see a decline. Although if you would notice in this chart, we were not able to return to the pre-surge level that we saw in January and February. So that's really crucial. And that's something that we have to keep in mind as I present in my other slides later. And then what happened was we saw an increase again in July. And currently, DOH is now reporting, this is as of today's data, more than 15,000 cases per day in the past week. And this is actually the country's highest 7-day average since the pandemic started. And like what I said, the problem really is that as you can see from the chart, while it is good that cases declined in May, we were not able to reach the numbers in January and February. And actually, we were not even able to consistently reach a level below 5,000. And thus, when cases started to rise in July, we were coming from a higher base of 5,000 and not the 2,000 that we saw in February. And now we're seeing the result. The 18,332 cases reported yesterday is actually the Philippines' highest single-day tally. Next slide, please. And as for our 4 highest single-day tallies so far, they were all reported just this August 20 to 23. So that's 4 consecutive days, no? And that's a total of nearly 70,000 cases in 4 consecutive days. Before, we were reporting 70,000 cases, that's for the whole month already. So that's how bad this current increase is, no, right now. Next slide, please. So here's another way of actually visualizing the first chart, where I actually broke it down into NCR and areas outside NCR. So the dark orange bars here are cases from Metro Manila. And as you can see, the current 7-day average in Metro Manila is 4,000 cases. So it's evident, no, that there's an increase in NCR, as you can see from this chart. But like what I said earlier, the 7-day average for the whole country is more than 15,000 cases. So if you have 4,000 cases in Metro Manila, that means that it only accounts for less than 30% of the national total. Now, the reason why cases at the national level are still high at 15,000 per day is because of the increase in areas outside Metro Manila. And by the way, when I say cases are at 15,000, the daily average is actually pulled down by Tuesday and Wednesday numbers. And in case you haven't noticed, there's seasonality in DOH reporting, and cases are relatively lower every Tuesday and Wednesday because this reflects the lower number of tests conducted over the weekend. Because you have some laboratories that stop operations on weekends and they actually do disinfection, no, on these days. So you'll notice in the daily reports, like today, DOH reported 12,000 cases from yesterday's 18,000. So some people might think that we're seeing a decline, but that's not the case, no? So what we should do here is actually not to compare the 12,000 today to yesterday's 18,000, but rather compare that 12,000 today to the number last Tuesday, which is 10,035, no? So that's how you do your comparison. It's the number today relative to last week, just to remove that seasonality. And what we're seeing is that from 10,000 last Tuesday, it's now 12,000. So the number is still going up, actually. Next slide, please. So this chart shows us the breakdown of total cases. Now it's at over 1.8 million, no? And as you can see, most of these cases have now recovered, and that's in green. Actually, for a time, I don't know if you're familiar with the Sunday mass recovery of DOH, no? Where they report tens of thousands of recoveries every Sunday, and they're just hundreds from Monday to Saturday, no? Good. So like every Sunday, you'd see 70,000 recoveries, and then for a Monday, it would be back to like 200, 300. But what's good is that DOH actually stopped doing that, no, in April, because it's a practice that's only implemented in the Philippines. Medyo nag-segue lang. But meanwhile, the active cases in red, right now, it's at its highest level, as you can see, in over 4 months, at around 130,000. So next slide, please. So this is the chart I presented earlier is cases. Now this chart is for deaths. And right now, if you look at that 7-day average, it's at 258 deaths per day. And that is actually the country's highest 7-day average since the start of the pandemic. So just this past week, if you look at the numbers of deaths that are reported by the Department of Health, it's at least 150 daily for the past week. And that really pushed the daily average to its highest, no, since the pandemic started. As for today, there are 303 additional deaths that were reported, and it's the 5th highest reported in a day. And as a result, the COVID-19 death toll for the Philippines has now breached 32,000. Next slide, please. So all this data that I'm using is as of today, and today is August 24, and on this day last month, that's July 24, total deaths in the country breached 27,000. So today we breached 32,000, which means that more than 5,000 deaths were actually reported in exactly 1 month. That's how bad the number of deaths are right now. And the last 1,000 additional deaths only took 4 days, because that's already the fastest ever, for the latest 1,000, because just last August 20, the total deaths breached 31,000. And now we've breached 32,000 after 4 days, So this is really alarming if you're reporting more than 1,000 deaths in just 4 days. And right now, the 32,000 deaths of the Philippines, it's actually the 2nd highest in Southeast Asia, behind Indonesia. And another thing that we have to remember is that when we talk about the COVID-19 deaths in the Philippines that are reported by the Department of Health, this is only among those who are confirmed RT-PCR positive. So we're not even talking about the suspect cases or the probable cases, Next slide, please. So this is from the Philippine Statistics Authority, for 2020. They released this report just a few weeks ago, where they reported 27,967 deaths under COVID-19 for 2020, and 19,758. So that's the first thread, the one I highlighted there. They were reported under COVID-19 virus not identified, and 8,209 were under COVID-19 virus identified. So, but if we look at the official records of the Department of Health, they only reported 9,000 deaths in 2020. So why is there such a disparity? So we're talking about 28,000 deaths from the Philippine Statistics Authority and 9,000 deaths from the Department of Health. So the explanation of DOH is that the PSA's 28,000 COVID death count for 2020 included suspect and probable cases. But as for the count of DOH, there should be complete date of death, validated cause of death, so all these other details. So basically what I'm saying is that these deaths that we have right now that are reported by the Department of Health, there's a possibility that these deaths are still underreported because we are only counting those confirmed COVID-19 deaths. Next slide, please. Now let's look at demographics just so we have an idea of what's happening. So what I'm doing now is that we're not just looking at the numbers, we're breaking them down from across different indicators, and just so we have an idea of what's really happening, because that's how we would really appreciate the numbers as well as have an idea of the policy implementations that we would like to suggest. If you're someone that's looking at all these numbers. So as you can see from this left chart, most of the confirmed cases are from the 20 to 49 years old age group. So if we look at the ratio, actually more than 3 out of 5 confirmed cases in the Philippines come from this 20 to 49-year-old age group. But if we look at the deaths on the right, more than 80% are those 50 years old and above. So it's very evident that the younger age group is leading the spread of COVID-19 in the country, and most are mild or asymptomatic. However, the problem here is that they risk infecting the older age groups who may be more vulnerable. Next slide, please. So what are the other indicators that we need to take into account? So here are some, positivity rate, testing, ICU bed occupancy, and let's talk about them one by one. Next slide, please. So the positivity rate, that's basically measured by the number of individuals who are testing positive over the total number of individuals tested. So the World Health Organization benchmark is a positivity rate of 5% or lower for 2 weeks. And right now, we're seeing a positivity rate of 25%, no, the past few days. So basically, what this means is that our current positivity rate is 5 times higher than the WHO benchmark of 5%. But what's good is that the increase in the positivity rate, if you would notice in this chart, it's also slowing down, no, as you can see. But it's still increasing, but the increase is not as steep as what we saw in previous weeks. Hopefully, we'll see a decline sooner than later because our current level is really high at 25%. Imagine, out of 4 people you are testing, 1 is turning out positive. So that's a really, that's an indicator that the level of transmission is really high. Next slide, please. Now, if we look at the regional positivity rates, this is where it actually gets more interesting. The positivity rate for the Philippines in the past 2 weeks is at over 24%, and that's the black bar that you can see in this chart. But if you look at the other regions, we have a positivity rate of, like for Region 10 or Northern Mindanao, it has a positivity rate of over 41%. And 4 other regions are above 30%. And actually, it's only Region 9 who has a positivity rate of below 18% in the same period. So what could this high positivity rates in certain regions tell us? Well, first, transmission is really bad on the ground now. And secondly, these regions are simply not testing enough. So that's really the implications of this really high positivity rates, no? Because if the likelihood of getting a positive result is as high as 2 out of 5 in Region 10, then you definitely need to test more. Because there are a lot of carriers going around undetected if the likelihood of getting a positive test is relatively high. So again, it's becoming clear that this current spike that we're seeing, it's happening all over the place. And we really need to test more. Next slide, please. Well, the good news is that when we talk about testing, we're currently testing more than ever. And our latest 7-day average is actually at 66,000 samples tested per day. And like what I said earlier, our positivity rate, however, remains high. And again, this tells us that we need to test more, especially in areas where the transmission rates are high. In Indonesia, Malaysia, Thailand, Vietnam, we see them testing at least 100,000 on some days. Right now, Malaysia is testing more than 100,000. The same thing for Indonesia. And in fact, if we look at our own numbers, if the government target is a positivity rate of 5%, we should be testing at least 300,000 people per day. Because our daily average right now is at 15,000. So 15,000 divided by 300,000, that is 5%. So we have to test at least 300,000 if we are to, if the goal is to reach 5%. And at least 300,000 because that's assuming that the positivity rate would go down linearly if you test more, which is not likely the case. So you even have to test more than 300,000 at the current rate of transmission. So that just gives us an idea of where we are right now in terms of testing. But as you can see from this chart, it's a good start now that we're seeing testing go up. And I really hope that this gets sustained. But what's important for me really is that testing also has to be complemented by efficient contact tracing. Because the tracing czar, si Mayor Magalong, he said that for one positive case, the ideal contact tracing ratio is 37 close contacts must be traced for every one positive case. And right now, we're still far away from that ratio. And clearly, it's really the weakest part of our pandemic response. Like, you have to imagine if DOH is now reporting an average of 15,000 cases daily, then we should be tracing 15,000 times 37. So that's what? 555,000 daily. And we're not seeing this in our daily testing figures. Up to now, we know that we don't even have a unified contact tracing app that is integrated to a wider central database. And it's been more than a year. And if things don't improve, so going to happen is just we'll be left counting cases. And you can imagine this as something like chasing that one thing that's already on the 5th floor and you're still on the 2nd floor. And without an efficient testing and tracing system, what it would look like is that we'll always be a step behind the continued spread of the virus. So it's spreading now, but you're still testing cases that happened or transmission that happened days ago, no? So you'd always be one step behind, because the problem with our testing right now is that most of the time it remains to be confirmatory, whereas in other countries, testing is really massive. So it's used as a tool to prevent the further spread of the virus. So it's more proactive, and you get to detect carriers earlier. And I understand that testing is really expensive, no? But for me, imposing lockdowns is going to be way more costly. And if we do the math and assume that a PCR test costs, let's say, a maximum of 5,000 pesos, given the price cap. So that's quite expensive na, no, at 5,000. And we test 300,000 per day, then that's equivalent to 1.5 billion pesos in a day. And if you multiply that by 7, that's equivalent to 10.5 billion pesos in a week for testing. But how about the ECQ? According to NEDA, and this is the recent estimate, the estimated impact of the recent ECQ was actually at 151 billion per week. So it's 10.5 billion versus 151 billion, 15 times higher. So we really need to test more, so that we'll be able to identify the carriers earlier and do the necessary interventions like tracing, isolation, and in doing so, we'll be able to avoid the costly large-scale lockdowns that we're seeing in recent weeks. Next slide, please. So another indicator is ICU bed occupancy, so that we have an idea regarding the status of our critical care capacity, no? And it's the same story. Basically, the same story that I kept on saying in the past few slides, no? So the red bars here are occupied beds. And at the national level, the Philippines has an ICU bed occupancy rate of 73%, which is considered as high risk. And actually, the 73% ICU bed occupancy rate is already the highest since this data became available last year. And if we dig deeper and look at the regions, we can see from this chart that 3 regions are in the critical zone. So that's an occupancy rate of above 85%. And then we also see 6 regions that are at high risk, including NCR. So again, if we look at cases, the higher national total that we're seeing, it's not just because of NCR. We're seeing it all over the place now. And the problem here is that an outbreak in different places all over the country will definitely result in an overwhelmed health system. And that's a terrible outcome, definitely, because we have limited resources and not all health system capacity is created equal, no? Especially in areas outside Metro Manila. These places are not as well equipped as the hospitals that we see in NCR, no? And this is why we really need to look beyond the national totals that DOH is reporting daily. And we really have to look at more granular data by processing the raw data set, no? Otherwise, we won't see these findings from the data set. Next slide, please. Now let's talk about the COVID-19 outlook, no? And let's first discuss the recent ECQ. Next slide, please. So like what I said earlier, there's really an increase in cases in NCR. So this is a chart that's basically showing us reported cases in Metro Manila with the 7-day average. But if you would notice the trend the past few days, you'd see that the growth rate in NCR in the past week, it's just at 13%. And this is significantly lower than the 60%, no, growth rate in the previous week. And you'd see in the chart that it's clearly, we're seeing a slowdown in the increase, no? So it's no longer as steep as what we saw in the previous weeks. And in addition to that, you'd also notice that cases in NCR right now, they have yet to reach the April peak. You see that? And the reason is that when the government imposed an ECQ, during the April peak, it happened on March 29. The 7-day average during that time in NCR was almost 5,000 cases already. But in the recent ECQ that was imposed on August 6, the 7-day average was not even 2,000 yet. It was at 1,800 to 1,900. No? So in terms of timing, this recent ECQ that was imposed was definitely better. No, it's more proactive. But that being said, we're facing a more transmissible variant in Delta, and as you can see, the cases now they're still increasing in NCR, but the pace, as you can see, is not going to be as steep as what we saw in previous weeks. Next slide, please. So let me show you this chart again. No, so this is the combination of NCR and the national total. No, so if you're going to ask me if the recent ECQ, whether the recent ECQ worked, just to give you a numerical example, yesterday we know that DOH reported a record high of 18,000 cases, and nearly 5,000 cases were from Metro Manila. And yet, that's just around 1/4 of the total tally of more than 18,000, because more than 4,000 cases were also reported from Calabar Zone. It's actually the highest increase on record, no, for Region 4A, and an additional 2,000 cases from Central Zone. 4 more regions with at least 800 cases. You have 1,500 actually in Cagayan Valley, nearly 1,000 from Central Visayas, and 800 each from Northern Mindanao and Western Visayas. So it's not just an NCR problem. And just to cite more numbers, during the April peak, so if you would look at this chart, you'd see that more than 50% of the cases were coming from Metro Manila. So when NCR and surrounding areas were placed under ECQ during that time, no, and actually we had that NCR plus bubble, no, it started during that time. So as you can see, the cases actually declined. So the orange bar here just corresponds to NCR. It's not yet doesn't take into account the bubble NCR plus bubble pan, no. But what we saw then was the cases actually declined and the national total followed, because there wasn't really much of a significant increase in areas outside the NCR plus bubble. But right now, the number of cases, as you can see from at the extreme right of the chart, the number of cases again from NCR only account for less than 30% of the total. So this is a very different spike, no, compared to the ones that we saw before. And the difference is really, this is not just a Metro Manila problem. And yet, the stricter restrictions were only imposed in Metro Manila and a few other areas. So the rest were under either MECQ, no, or GCQ. So really, we can't assess the ECQ that was imposed in NCR, and then we make sweeping conclusions about it by looking at the national total. So that's just basically comparing apples to oranges. And yet, unfortunately, a lot of people do that. No, there were a lot of conclusions already that were being made that the ECQ failed. But you know, if you look at historical data, any kind of intervention that you would introduce, whether an ECQ, MECQ, or whatever lockdown quarantine condition, no, the effect on the numbers would be seen at least 2 to 3 weeks after. And right now we're starting to see the decline in the growth rate in NCR, because that's where the ECQ was imposed. It wasn't imposed in the whole country, no. And we're seeing that the cases are actually increasing in a lot of different areas. But anyway, going back, there's always this 2-week delay, no, before we see the impact of the intervention, because you know when a transmission happens, it's there's a certain lag time before you get tested, right? And you still have to wait for the results of the of your test, whether it's positive or negative. And then when it's positive, it still takes a few days before DOH gets to report the case, no, because it has to undergo case validation. So there's that delay, no, from the time of transmission to the time of DOH actually reporting the case. So for yesterday's 18,000, I saw a lot of people saying na wala, the ECQ did not work because right now we're still seeing 18,000. But the 18,000 cases are actually most of those transmission, the infections happened 2 weeks back. So that's how you look at things, no? So it's still too early to say that the ECQ actually failed, because if you look at the chart for NCR, we're seeing progress, no? And hopefully, well, I just give the outlook, the full outlook na lang later. And again, it's very clear naman from the previous chart that we're seeing that NCR, the curve for NCR is no longer as steep naman eh. So hopefully the slowdown in the growth rate continues. But for me, what's clear right now, it's just the battle is really a different one compared to before, because the increase is just really seen across different areas and provinces in the Philippines. Next slide, please. Now, vaccination is going to be key moving forward. And here are the latest vaccine numbers, no, as of August 22, where the Philippines actually hit the 30 million mark in terms of vaccine doses administered. And of this 30 million, 17.2 million are first dose recipients, while 13.1 million are fully vaccinated individuals. So that's around 12%, no? So in terms of fully vaccinated individuals, that's 12% of the total population. And the latest 7-day average of vaccine doses administered is 370,000 for the past week. So that's per day, no? And if you would look at my tweet on the right, we're seeing actually a decline for the third straight week now in terms of vaccine doses administered. The highest daily average for a week since the start of the rollout on March 1 was the 523,000 from July 26 to August 1. So this was before the lockdown, when we were seeing an increase in the vaccine rollout. And Secretary Galvez actually attributed this decline to the stricter lockdown conditions, which really affected the vaccination numbers. No? But nevertheless, these numbers are definitely a significant improvement compared to previous months. But for us to reach our target of inoculating 70 million people before the end of the year, the pace should now be at 800,000 per day. So we're still far from that figure. And again, we have 13 million people who are fully vaccinated, and the target is 70 million people by the end of the year. And we have what? Around 4 months left in 2021. So it's really going to be a challenge, no? And the question now is, do we have enough supplies of COVID-19 vaccines? Next slide, please. So we now have 48.5 million vaccine doses, and that's enough for around 26 million people, given the 3.2 million doses of the single shot of J&J. And we know that there are scheduled deliveries in the coming months, but as of the moment, if we have 48.5 million doses and we have only administered 30.4 million, then we still have around 18 million in the current supply, and that gives us enough buffer given our current pace. And of course, the increase in vaccine supply will definitely change the equation in the coming months, as well as private sector participation. But the vaccine supply is not really the only variable that matters, because right now we still have enough supply, and we definitely need more people who are actually administering the vaccine doses and more vaccination sites as part of the supply side of the equation. But on the demand side, we have to continue to address vaccine hesitancy. And if you look at all these numbers that we're seeing now, vaccinating 70 million before the end of the year is really going to be a challenge. Next slide, please. And now here's the game changer, no? The Delta variant, which was first identified in India. It's believed to be more transmissible. So as you can see from this infographic with Imperial College and Lancet as source, the one on the right, the Alpha variant is the variant first identified in the United Kingdom, and it is 60% more transmissible than the original strain from Wuhan. And the Delta variant that we have now is 60% more transmissible than the Alpha variant. So it's not even 60% more transmissible than the original strain. So what this means is that on the average, if around 2.5 people are infected by the original strain, this becomes 4 to 5 people on average with the Alpha variant. And for the Delta, it's now 5 to as many as 8. No? So that's how contagious this variant is. And the question that we have now is that how many variants do we have in the Philippines? Next slide, please. So the answer is that as of August 21, we have more than 6,500 total variant cases. So imagine that 6,500 out of more than 1.8 million COVID-19 cases in the Philippines. No? So what does this data tell us? Well, it's evident that our genome sequencing capacity is really limited. Can you imagine we have over 1.8 million total cases and only 6,500 are variants? And also, if you look at the numbers on the left, most of the patients, as you can see, they have already recovered or died once the results arrive. So we have around 130,000 active cases now. But if you look at the variants, we only have 58 out of around 130,000 active cases. I mean, that's unlikely the real picture on the ground. And if you look at the table on the right, from the latest batch, we have sequenced 746 samples, no, in the latest batch. Ideally, we should be sequencing 5% of our daily cases. So if we're reporting around 15,000 cases per day, then we should be sequencing 750 daily. But if you look at the table, we have sequenced 746 from August 13 to August 21. No? So that's really our limitation right now, because we only have one machine responsible for genome sequencing, and it can only do 750 per week. And in addition to that, you have genome sequencing kits and other consumables also that add to the cost. No? So it's because of these logistical issues why we're only sequencing very limited samples. And like what I said, the timing is also crucial, because from a practical perspective, it will be really hard to strategize when the patient has already recovered or died before you know that it's actually a Delta variant. But in any case, we also have to note that the share of the Delta variant, as you can see on the table on the right, it's now increasing in the Philippines, and from the latest batch, it's now at 62%. And that's significantly higher than both the Alpha and the Beta variants combined. So what we're seeing now is that it's really Delta. No. Next slide, please. So globally, what we're seeing is that this is clearly a race between vaccines and variants. And at the end of the day, we have to remember that more transmissions is just equivalent to more mutations. And we won't be fully protected until the whole world is protected. And, we always hear this quote that no one is safe unless everyone is. And, it sounds idealistic, but in reality, a lot of experts have been repeatedly saying that when you're dealing with an infectious disease, when you're dealing with infectious diseases in a global scale, the most effective way really to be selfish is to be generous. So we really have to ramp up the vaccination, not just for the Philippines, but for other countries as well, no? Especially the poorer countries. Next slide, please. So unfortunately, 20,000 daily cases is really possible. The Philippines will breach 1.9 million total cases before the end of the month, and 2 million total cases by early September. That's something that would really, by early September, that's something that's, from my forecast, that's going to happen. And actually, if you look at the trend from 1.7 million cases to 1.8 million, it only took 8 days. And that's already the fastest 100,000 additional cases for the country so far. But right now, what we're seeing is that it's likely that the latest 100,000 from 1.8 million to 1.9 million will be even faster. And for NCR, I don't see a sustained decrease happening within the month of August, but hopefully we'll see it by September. But we definitely have to contain the spread in other regions as well. I mean, it's something that I cannot emphasize enough, no, because the increase that we're seeing now is really, it's not just NCR centric. And in my opinion, only with a calibrated relaxation of restrictions in specific sectors and an aggressive vaccination rollout will the country be poised to revive our consumption-driven economy. any premature relaxation of restrictions would just end up leading to more mutations, and that will just prolong the pandemic. Because in my very first chart, you've seen that we were not able to really drive the cases down to below 5,000. And when we reopened, which coincided actually with the arrival of the Delta variant, which really made the situation even worse. No, so you're starting from a base that is quite high, that's 5,000, and we're seeing the numbers now as a result. No, so again, we have to be very calibrated and very strategic with any plans of relaxation of restrictions. Next slide, please. So that's it. That's it from my end. You can reach me via email. I attached this on this last slide, and also through my social media accounts on Twitter. It's at twitter.com/EdsonCigido, and then on Facebook, facebook.com/EdsonCigido. And again, thank you, JCI Manila, for having me, and good evening.
Presentation again, and there's so much data, so much to internalize. But one of the main takeaways I got there was our age bracket. I think we're in the same age bracket. Our age bracket was the one, the main culprit of spreading the virus, but we're not the ones that are in trouble. So please minimize your movement, guys. I think I'll echo again Dr. Tony's suggestion earlier that we should do this together, and we should worry about all our loved ones, the older ones, and even the kids, because they're already getting infected with these other variants. So before I present our certificate of appreciation, we just have a few questions, Mr. Edson. Actually, I think these questions were earlier asked, but I think your presentation was too informative that you covered everything. But just in case, I'll ask them anyway. Have we reached? Actually, you've answered that. How about this one, Sir Edson? What's your forecast on when and what will it take for us to end this pandemic?
Well, definitely, we really have to ramp up our vaccination. No, so we saw that it's the same thing that happened in other countries. No, some semblance of normalcy. We saw that in the US, in the UK, in Israel, where they were able to reach a certain percentage of their population that's fully vaccinated, and as a result, they were able to see some semblance of normalcy. But for me personally, with this more transmissible Delta variant, it's really possible also that we really have to live with the virus. That's a possibility at this point. So, even if we get to a certain level of percentage of population that is vaccinated, we really have to continue to observe minimum health protocols like wearing masks, observing other minimum health standards. No, but at the same time, it really depends on our vaccine rollout. That's why I cannot really emphasize enough the crucial role of vaccinations. To your point earlier, Andre, you said that we have to also take into account, we also have to consider our elderly family members. For me, I would like to add that, we also have to try to ask them to also get vaccinated, because if you look at the numbers, a lot of senior citizens are not yet fully vaccinated, no? So as for A3, A4, we're seeing an increase, but for A2, there still seems to be some hesitancy, no? So I know that there are a lot of posts, a lot of misinformation that's going around regarding vaccines. So we have to do our part also to help inform people that vaccines work. They're highly effective in preventing severe disease, hospitalization, and deaths. Breakthrough cases are possible. It can happen, but your chances of getting severely sick from COVID is just significantly lower when you're vaccinated.
Yes. Okay. Thank you. Actually, my parents and my Lola are watching right now. Thank you for getting vaccinated, Mom and Lola.
Hello to them.
Yes, it kind of gave me a kind of relief, your answer, no? Second question. If vaccines are working, should we be seeing hospital rate utilization going down? What do you think is the reason why it isn't going down?
Actually, one of the reasons is that the percentage of the fully vaccinated in the Philippines is still very low at 12%. No, but if you look at the number of deaths, we're already seeing an impact in NCR because, like what I said earlier, we're seeing an increase in deaths. But the top regions are that Central Luzon, Region 3, and then Central Visayas, Region 7. It's not even NCR. And if you look at the provinces and highly urbanized cities, it's Bulacan, Pampanga, Nueva Ecija, Laguna. So it's really not NCR. So we're seeing an effect because, as you know, the vaccination strategy of the government also heavily focused on Metro Manila. No, so while we're seeing an increase in cases, the hope is that hospitalizations and deaths won't follow for Metro Manila for now. But that's the problem when you have a limited vaccine supply and you can't really have our vaccine rollout is still not up to the ideal level, no, of 800,000 per day, and your supplies are limited. Then you have to make a choice whether to give the vaccines first to NCR residents or just distribute it across the different regions. But there would really be a compromise, no, either way.
So I'm actually hoping that the latest news of Pfizer getting approved by the FDA can help the private sector in acquiring more vaccines for the Philippines. Few more questions. Does a smaller range community quarantine, in your opinion, will be more effective versus a city or region-wide community quarantine?
Well, if we're talking about effectivity in terms of curbing the number of cases and stopping the spread of the virus, of course, the more you limit the mobility of people, the better. So it has to be a larger scale, no. But at the same time, the recent ECQ that we saw this August compared to the ECQ that we saw in March and April 2020 is really different, no. You'd notice that last year, basically, no one's outside the house. Parang it's like a boxing fight of Pacquiao, no, every day during the ECQ last year. But for the recent ECQ, I mean, it's still traffic outside. Some people were posting on social media that they're outside most of the time. There's a lot of mobility going around. So I think for one, the ECQ now is different from ECQ before. But if we're talking about the effectivity of quarantine restrictions, I think if you're doing a large-scale restrictions, that would be more effective pa rin. But in terms of cost, we also have to balance it with the economic impact. And of course, it's going to be way more costly if you impose larger scale lockdowns. No, so for me, really, if you want to balance that and measure it in terms of efficiency, no, if you measure it in terms of efficiency by say looking at the number of cases and then the cost, I think a large scale lockdown is not going to be that feasible anymore. But for me, what really matters is that we have this mindset that the lockdown is not going to be the long-term solution. It's still testing, tracing, and isolation. Lockdown would only help us buy time. It's supposed to help us scale up our infrastructure in terms of testing, in terms of tracing, in terms of isolation and vaccination. And in the past 2 weeks, the ECQ that we did, ideally, dun sa 2 weeks na yun, dapat you were able to identify, you were able to identify all the infected and do the necessary interventions.
Yeah.
But we were testing 50 to 60,000, so obviously we were not able to identify all the infected, no, and do the necessary intervention. So if you're going to just go to ECQ as your default option moving forward, and you're not going to complement it with widespread testing, aggressive tracing, and strict isolation, then you're not going to maximize the large-scale ECQs. And what you'd end up doing is that you're going to just really hurt the economy really bad.
I agree. Wholeheartedly agree, Sir Edson. Last question, and this is for JCI Manila. We know that you've been attending more and more JCI events recently, and We would like to know if you're willing to work with us in the future and maybe even join our organization. Would that be open? Would that be an open invitation for you, Sir Edson?
Yeah, of course, of course. It's something that can explore, no, moving forward. It's just that right now, personally, my focus is really helping inform people during this pandemic with my work. Halos talagang walang tulog na eh. Because
Yeah.
if you have to monitor all these indicators and then all these indicators change by the day. Because just the other day, we're seeing some improvements in the positivity rate last week. And then we saw a U-turn, unfortunately. So things can change very quickly. You can't use like in my presentation today, if you would notice, I'm using latest data because if I use data from 2 days ago, then it's possibly going to be a different narrative altogether.
Thank you so much, Sir Edson, not just for informing us, not just for sharing your insights today, but also for all your work in helping us battle this COVID-19 pandemic. Thank you so much. And with that said, may we present you with this certificate of appreciation. The certificate of appreciation is hereby awarded to Mr. Edson C. Guido for generously sharing his time, dedication, and expertise of being one of the resource speakers in our webinar series entitled COVID-19, Delta, Lambda, Boosters, and Outlook, held via online platform given the 24th day of August 2021. So thank you so much, Sir Edson. Thank you.
Thank you also for having me, and hopefully we get to see the end of the pandemic soon. That's in my prayers every day. So maybe if we get to do another something like this again, hopefully it's no longer virtual, no.
Yes.
But my only message is that we really have to be patient. We have to help each other because if a lot of people are saying we want to go back to normal na. It's been more than a year. But if you want to get back to that normal now na hilaw pa talaga yung sitwasyon, mas tatagal pa yan. We can't be really we can't be complacent, we can't drop our guard. A lot of people I know, some of them are already fully vaccinated, and they have this mindset na I'm already fully vaccinated so I can do whatever I want. I mean, that's really a selfish mindset, no, for me, because you are unknowingly infecting some other people that are not yet vaccinated, and you have no idea that it actually happened. No, in May and June we saw a decline in the number of cases, but actually the number of cases outside Metro Manila, especially in some areas up there in the north, no, Region 1, Ilocos Norte, we saw an increase, and there were reports of people spending their vacation going to La Union, going to Ilocos Norte, because they're already fully vaccinated. And you might have unknowingly infected some people, and who knows, you might already have brought the Delta variant there, no? And now we're seeing the increase happening all over the country. So tulungan talaga to eh. Hindi pwedeng individual yung mindset when it comes to COVID-19.
Yes, thank you so much. So guys, let's do this together. Let's battle the pandemic together. That's the main takeaway from this webinar series. Always care for your neighbor, for your loved one, for everybody else, not just yourself. With that said, may I please call on our 2021 JCI Manila President for his closing remarks, and then we'll have a short picture taking after.
Members of the JCI Philippines National Board present, fellow Batch Dasig Presidents, 2021 JCI Senate Manila President Winston Larry C. Wu, to our speakers tonight, preventive health educator and health reform advocate, Dr. Tony Liatron, ABS-CBN Chief for Data Analytics, Mr. Edson Guido, COVID-19 Webinar Project Chairman Brian Ko, to all JCI past presidents, senators, past board of directors, JCI Manila brothers, good evening. First of all, on behalf of the JCI Manila Board of Directors, I would like to thank all the participants tonight for giving importance to this very informative and useful webinar. Likewise, to our speakers, Dr. Liatron and Mr. Guido, thank you for sharing your invaluable time, knowledge, and expertise with us. It is truly an honor to listen to both of you. In early 2020, COVID-19 ravaged upon the worldwide scene, spreading rapidly through a completely susceptible population. Today, as we face the dire effects of this pandemic, we know how equally important it is to be informed about the science and math of this pathogen. It is a valuable concept to understand so we can contribute in seeing the end of it or breaking its chain. There is no doubt that this pandemic has affected severely everyone, especially the poor and minority communities. It is crucial to consider the emerging new variants of concern, the race of developing new vaccines and booster shots, and the outlook of the future. Indeed, bringing back the old days may seem to be so close to impossible, but creating a new and better normal is achievable through the whole of community approach. We thank again our speakers for enlightening us on this aspect. In JCI, we are committed to supporting our nation in leading as one and to rebuild better from the COVID-19 pandemic through inclusive, resilient, and sustainable recovery strategies. We also continue to push for herd immunity and vaccination as the answer and solution. Congratulations again to our vaccination program and to our project chairman, Brian Ko, and his committee. And in closing, let me share with you a quote from Sir Winston Churchill: "Success is not final, failure is not final, it is the courage to continue that counts." So let us all continue to lead as one. Thank you again very much for joining us tonight. May God bless and keep you and your family safe always. Mabuhay po tayong lahat.
Okay, so time for a short picture taking. Tech committee, who's gonna join us? Hello there, Carl.
Hello.
Okay, so our first hand signal is for the month of August. So you're gonna go like that. Thank you. Chair, please take the photo.
One more. All right.
All
Lead
right.
us one.
And then one more hand sign. Lead us one.
1, 2, 3. All right.
All right. Thank you so much again, Sir Edison. We learned so much. And thank you and congratulations to the whole committee. Thank you. Thank you.
Thank you, and it's my honor as well, no? Please stay safe, everyone.
Stay safe. Thank
Stay
you.
safe.
Thank you, Edson.
Thank you. Thank you.
We possess the power to act, to lead, and to face adversity. Together, we stand to fight an invisible enemy. Together, we lead as one to win an invisible war. Together, we strive to preserve the voice of the future. The decisions made today determines the outcomes of tomorrow. It's time for you to decide.